There shouldn't be, I have to go to Dr. B and get my paperwork and bring my paperwork to Dr. A. That is the issue in interoperability, that all of these systems are in silo.
Welcome to Connecting Business. I'm your host, Christina Munoz. Today, I'm joined by JaLisa Johnson, who is the CEO of Virtual Emerging Technology Solutions and founder of 360 Spaces. Welcome, JaLisa. Thank you so much for joining us today.
Thank you, Christina, for having me. How you doing today?
Doing great. Thank you. So excited to
Good.
talk about using technology to create accessible healthcare that is for everyone. So, I am so excited to hear about the work you're doing to build technology that really benefits everyone, offers comfort, and gives people the care and resources that they actually need. So, I know we have a lot to discuss today. So, let's get right to it. So, what led you here and or prompted action from you?
Mostly, mostly that well-being is tied to health, and there's a lack of equity in healthcare today. Just my own personal experiences, dealing with the federal government, the state and local government, and looking at the programs that's out there that are not necessarily readily communicated to communities, to the people. Um, Little resources and things that I feel, could be different.
Very cool. Okay, so you saw this problem, you saw this need. Why do you think it is that this inequity, and it could be communities, neighborhoods, states? I'm not sure where you kind of saw the lines when you were seeing this issue.
I believe that given opportunity, in I like to use the word on preserved versus underserved communities.
Okay.
I think that funding is limited to this problem, and my goal is to build things that work in limited resources. So we come from humble beginnings. We grew up with limited resources, so you learned how to make lemonade out of lemons. And that's how I look at technology today, is find a way to create new things out of limited resources that could be worked for the people.
So we've mentioned this inequity that's out there, and you said underserved versus on preserve. I want to know more about that, but also kind of help me define the issue. What is the issue? Kind of digging deeper.
The issue is, a lack of is not across the board. You find that in catastrophes, no different than politics, that people, there is a have and a have not, and
Mhm.
people who do not have certain resources do not get certain resources. So it's not streamlined. The processes are not streamlined, and that goes in terms of the big health tech companies all the way to the hospital organizations, to the government. You know, Processes are not repeatable, they're not streamlined, and they're not interoperable. So there are no benefits for low income communities, for re entering citizens, for senior citizens, for brown and black girls and boys in the education system. There are just limited resources because they are not interoperable, period.
Hmm. And I think it could go without saying, but when you mention the benefits and the lack thereof, what happens to those people that don't have the same access, the same care, the same treatment really when it comes to healthcare?
I think that healthcare overall is failing in
Mm,
America. I mean, it's across the board. So whether you have millions of dollars, one of the things that COVID showed us
mm,
is it did
mhm.
not matter what resources you had afforded to you in this catastrophe, in this pandemic that we came across. Everyone was locked away in their homes. It didn't matter. I mean, if you look at, Ellen was in her house complaining that she was locked in a 30-bedroom house, with servants and pools and hot tubs. Where if you look at people from underserved communities, they're always locked in their homes. And, having access to things is not having access to things is a norm for them. So the pandemic showed that there's a problem in the healthcare system and how we respond to healthcare in general. So the system is broken. So if it's broken for the rich and the wealthy, there is non-existent to people in marginalized communities and who do not have the resources. So across the board, that's a bigger problem when you talk about equity.
Absolutely. When you think about those that are marginalized and don't have access, you know that there's not only more illness and issues, but preventative care is almost non-existent a lot of times because it's just
Absolutely.
not there's not an education there. There's not communication, like you said earlier. There. So let's talk about rights. When it comes to healthcare, do we have a right to quality healthcare? What are our rights as just people?
Well, things that you don't know is that, there are mandates in every state across the United States for how you want to be treated in healthcare, no differently than if you sign a will. If you sign a will and you tell your family, this is how I want to be laid to rest, then your family obviously should honor the rights of how you want to be laid to rest. Well, that same will exists, and it is a mandate in the federal government for all people to have certain directives that they call it on file. And we know, for say, like, if you go into the hospital just to have a random routine, they'll ask you to sign a piece of paper, right? So it's paper based mostly. Some hospitals have it where you log into some system that you don't know anything about and you fill
Right.
out a form to say, I want to be resuscitated, if something should happen to me. But those are living documents that you should have on file, and they should be free from every state to the people. And what has happened is that, the federal government has said, you have to have these mandates for your people in your states. So most states just post things on their website. They do nothing to inform the people about, these documents that should be on file with the state, and so you don't know about it. So how do you know how
Mhm.
you want to be treated in an emergency? So number one question asked when you went into the emergency room or something happened in COVID was, do you have a medical directive? 99% of the people didn't have medical directives, rich or poor,
Wow.
because you don't know that they exist unless you going in for, when you go into the hospital and you say, I'm going in, I'm having this procedure, and they say, your doctor will say, I need you to fill out this form for resuscitation. Most people know about that form if you've been in a hospital. This is, I want to be resuscitated. That is a medical directive.
Right.
But how about your advanced directives? How about your medical orders to sustain treatment? How about your right, to die? Most people don't know that there is a Death with Dignity Act.
Mm.
That if you're sick if you're chronically sick and you have a right in that state. Some states have passed the law, some states haven't passed the law. We know that Washington, D.C. Was one of the latest states that have passed the law, I think in 2018 or 2019. I don't remember exactly, but
Mhm.
you have a right to die with dignity. And
Mhm.
it's not publicly out there. I mean, you might have done one interview or talked to the people in your state, but it's not readily available. Yes, if you go to their websites, you'll see a document to download as a PDF. But what you will find is there are a lot of corporations out here who have partnered with hospitals to provide these documents to people. And some of them you have to pay for. Most of them are being built in silos that you don't really have access to. The hospital organization has access to it. There's nothing for the people that is interoperable that can be shared with their family members, provided by them on their phone. So when you're traveling abroad, almost like your state ID, it's not integrated with your driver's license or your passport. So if you travel abroad, no one knows your rights. If you travel across state lines, no one knows your rights because everything is being built for data control by a specific organization. And that's why there's a lack of equity, because I can't go into California and get sick and have my rights, accessed because I'm not part of the hospital system in California. But if the
Right.
federal government and the states came together to decide There is one platform, no different than the driver's license. They have the new one driver's license that's going across the whole United States, no
Mhm.
different than a passport that the federal government mandates, right? These
Right.
rights should be as simple as that. I mean, you can donate blood, you can donate your organs on your driver's license. So why is it that my rights on how I want to be treated in healthcare and my health is not available to me or available to emergency management vehicles, doctors, and not hospitals? So we should separate it from hospitals who are built to get rich and stay rich, right?
Mm,
Versus
right.
doctors who take an oath when you get a license to protect and serve your patients.
Mhm.
How is it that the hospitals get to decide how a doctor treats you versus the oath that you take in that state and you get a license under? So
Wow.
there's just a lack of that accountability in healthcare today, and everyone's out to get rich, or they just don't have the resources to even help their patients. So I don't say that every doctor doesn't want to help their patients
Sure.
in that way.
Right. No, but you make some great points, and it really is one of those things that, people might say, "How's your healthcare system?" "Great." "Have you ever used it?" "No." So they have no idea,
No
and that's
idea.
why and when you do need it, unfortunately, it's probably an emergency situation, paperwork, decisions, there's a timing issue here, and so you're so right about communicating this information before you need it, because once you need it, it could be too late or it could be a bad situation and all of those kinds of things. So you've done a great job of kind of laying the groundwork for the issue, the problem. So when it comes to the solution and the action, tell us about virtual emergent technology solutions and what you're trying to do.
Well, what we do today is, we support existing healthcare agencies. So one of our clients is the Department of Health. And what we do every day is to support their data centers, support their applications that are tracking health disparities, diseases, helping them to move into the cloud, building sustainability, helping them with cybersecurity requirements. But most of all, we have also developed a commercial line outside of the government space to help protect the people and also to be an advocate for the people. No different than we are helping to build these systems in the government. We would like to help the people access these systems and have equity across the board for things that they are aware of and things that they are not aware of.
Well, a huge task, no doubt, because all the things you mentioned, when you talk about streamlining, it's just an absolutely huge task. So let's get into the technology. And you mentioned cybersecurity. And I just got to think, man, it's just so important. I know it's important with financial stuff as well, but when you get into healthcare and medicine and your privacy rights, how do you go about when it comes to technology and cybersecurity, making sure it's all safe?
You know, the transition to the cloud has, its benefits and it has its, you know, things that, a lot of people are not comfortable with.
Sure.
Um, the cloud is a way for us to take things to market a lot faster.
Mhm.
Um, but it also has a lot of holes because, we obviously have a lot of cyber threats, a
Mm.
lot of things happening behind the scenes that we don't see and do every day. It makes it does also help us preserve data. Everyone's data is key right now, right? So moving into the cloud for us has been, developing the cybersecurity posture before you develop an application.
Mm.
uh, our goals are to, protect the data of every person who goes into a system. And since we have been doing it so long for agencies like the Department of Homeland Security, agencies like TSA, and now the Department of Health, we understand the process of protecting data. That is something that, we believe that we're experts in first. Bringing in applications on top of that. So the top layer is security, bringing in applications that um, work with the security is incredibly, important. A lot of agencies and companies build applications. So let's say you just build what they call COTS, commercial off the shelf products. Those are just built to go out, but you don't know if they have the security that is required. So those are things that stifle the government. You know, there's a huge process in bringing applications forward to support government mandates. That means you have to have a security posture that is tight, and there's a lot of framework around it. Some of the things that you're able to get away with in the cloud, you weren't able to get away with in-person data centers. So the cloud has helped, you know, streamline some of those processes. It's made it a lot easier going into different CRMs that have pre-built platforms, going into GovCloud. The healthcare industry has a tremendous opportunity to restructure, redesign, remodel, and re-engineer for interoperability. There's no reason why the healthcare systems don't have interoperability today, because it's available. And as a small company, I have limited resources, but these conglomerates have billions and billions of dollars in resources, but they don't want to be interoperable. Some companies just don't. They don't have to be. They don't have to be. You know, there's no competitions for them really. And for us, it's about, you know, making sure that there's APIs across all applications and the capability to talk to each other. That's the only way that, you know, we can have a better healthcare system, a better education system. It's not just healthcare, you know, that there's disparities. It's across the board.
Yeah.
And
You're
technology
so right about
leverages
that.
that.
Yes, that's exactly it. And so you said you guys have been doing this a long time. And it really, when you talk about the individual hospitals, it's really the difference between what's best for the person and what's best for the hospital, because we as people can be going to different places. So explain and define that word interoperability, and what does it mean and how do you offer that?
Interoperability means that if I go to Dr. A and Dr. A is treating me for one thing, and Dr. A is in one healthcare system, then if I go to Dr. B and he's in another healthcare system and he's treating me for another ailment, then their system should communicate. There shouldn't be I have to go to Dr. B and get my paperwork and bring my paperwork to Dr. A. That is the issue in interoperability, that all of these systems are in silo. I'll use some names. If I go to Kaiser and I'm getting treated at Kaiser, then I can't go to a healthcare system like um, Dignity Health and say, well, I was seen at Kaiser for this, and they did blood work and they did you know, x-rays, and they have all of my health records in terms of this problem. I go over to Dignity Health and they have something totally different. So the problem is that now you'll see where you log into a portal and you'll say, oh, I have this health portal and it has my medical records, right? But those medical records have to be downloaded, and or you have to sign a document, send it over to this doctor. So in an emergency, there is no way that you're communicating your medical needs and your medical history from organization to organization, because they continue to be built in silos. And when you have a company like Epic, which is a $1 trillion organization that has been around, is in all the hospital systems all across the world, there's no reason to have interoperability because they are the kings. They don't have to play with anybody. They don't have any APIs that you can attach to. So how does the VA help veterans? Because if you're a veteran and you're out here as a civilian and you go to the doctor and you don't go to the VA hospital you choose. So for instance, I'm a veteran, I have veteran benefits. No, like I'm not a veteran personally. This is an example, right?
Sure.
If I have veteran benefits, but I also work a job and I have benefits there, I get to choose which one I want to use. The problem is that they don't talk to each other.
Oh,
So if I
makes
go
it
to
complicated.
if I go to my civilian doctor doesn't necessarily have access to veterans affairs that has my healthcare record. So it's almost like I have two different lives. I have a real life, then I have a virtual life. And those two worlds have to meet, and I have to be the advocate for that. So if I'm weak and sick, or handicap or anything, and I don't have the means to be my own advocate, then I just don't get the help I need. I don't have
Wow.
anyone to really facilitate that gap of, it's really a communication problem, right? So when you
Mhm.
break that word interoperability down, there is no communication. And the
That
federal government
really is
said
the
our
issue.
systems should be digitized. Then COVID hit, right?
Oh,
So
right.
you have 2 years to 2 extended years to get all systems digitized, which the government says get everything on the cloud or get everything digital so that there should be some way for you to reach people digitally. But even though the systems have been built to be digital, they're in silos. They all work independently. And it's not just healthcare. You know,
Right.
there has to be some type of reform on the federal government side that says, guess what? We have a platform. All of you will tie into our platform if you want to practice health. Or you give the doctors that responsibility, not the
Okay.
organizations. You give the doctors tools, almost like a tool bag. So they have a tool bag, right? They have their
Mhm.
stethoscope, they have their earlobes, they have things in that tool bag that they can see patients every day. But what they
Right.
don't have is a digital tool bag that
Hmm.
they can utilize and streamline from doctor to doctor. There's like a inner circle that has to happen. And doctors and practitioners should be able to communicate with each other outside of organizations. Organizations build silos to keep data and house things for their needs. Doctors are here to serve the people and should be able to communicate one to one by their license. Their license should automatically include them in certain things. If I give a doctor permission by hitting a button and say, this doctor can look at my records, then that doctor should be able to look at my records.
Mhm.
That's the systems that we're building at Virtual Emerging Technology Solutions.
Wow, and you can tell you are so passionate about it and how important this need is. And we've talked about emergency situations, but then there's also like we've said, crossing state lines and crossing, making sure that somebody in this doctor would know this doctor. And if we could quiz our viewers and our listeners, I bet so many of them could tell stories about going to Doctor A and Doctor B and the nightmare of the paperwork and the exchange. And so you're speaking a language I think we all understand. It's just now that hurdle from getting to the problem and getting to that solution. So, we've talked about COVID, what a huge impact on the healthcare industry, among other industries, of course. But let's talk about 360 spaces. First, what is that and how does it work?
360 Spaces, we started building when we saw that there was disproportionate, uneven levels of healthcare, like we say all the time in the pandemic. Um, I remember sitting home and watching people, line up at the hospitals and, wanting to see their relatives. I mean, COVID was just like, it took your breath away. You had to really sit in it. And if you really love, healthcare and improvements, you can't stand by and just watch. It broke my heart to see friends and families, people from all over the world, going into the hospitals and not coming out. And the worst thing ever is to go into the hospitals and you don't even have a family member. Your families
Mhm.
can't even go into the emergency rooms with you. And it's not that they didn't want it. It couldn't happen. There was
Right.
limited resources. We didn't have any information really about, this invisible killer. It was heartbreaking. And the only thing I saw was, I remember watching this YouTube video, um, and Bill Gates said it will be missiles. It won't be missiles. It'll be micros that kill us. So the world is preparing for missiles, to drop and kill us. And we have a micro that
Mm.
is invisible, that we can't see, that we breathe in, that we touch and we take in. And because of that, we can't even see our families. And I remember a friend of mine calling and saying that her mother was in ICU and she didn't even have the availability to get a phone to her. And when the ambulance took her mother in, it was the scariest thing. And I said, I have to do something. What can we do to make this better? How can we, it can't help, it may not be able to do it right now, but how can we build for the future so
Right.
that if we have, you know, something airborne, which we will continue now that we've gotten it,
Right.
this will happen, right? So we've
Right.
had Ebola, we've had different things happen and,
Yeah.
you know, kind of got under wraps really quick. But this silent, invisible disease
Mm.
that I call it, you know, has taken the airwaves. And how do we protect ourselves? How do we protect the communities that are underprivileged or underserved or
Yeah.
marginalized and they don't have the resources to isolate? So your whole family is going to get sick because you can't isolate. And if I send you home, this is the only options. And that's what has happened now, right? So now it's almost
Mhm.
like herd immunity. Everybody just gets sick and deal with it. And but we don't
Mm.
know what the risk is to anybody specifically. So we created these 360 spaces almost as a hospital without walls. And it would allow for a patient to be isolated and still be able to be treated and seen and visited by their family members. It would allow for a patient to have their medical directives in house with them so that their family and friends would be able to understand their rights. It would allow doctors and practitioners to also be protected while treating them, almost in an ambulatory way. So right now you go into the hospitals and the doctors are in full gear and they're treating patients and everything's airborne. So if you walk into a hospital right now, the patients are sitting on gurneys, on cots or whatever. They don't have no mask on, but the doctors are protected. So even if you go into the hospital and you don't have COVID, you're gonna come out of there with COVID because it's airborne. So how do you protect people and how do you get help at the same time? So 360 Spaces was built to help in those instances and to provide expansion communities all around the country that would be leveraged in these type of emergencies. So not just for the pandemic, but we looked at how many different ways it could help. It could help with the homeless situations that is
Mm.
horrific all over the country. It could help with border patrol services where you have people just living in tents. It could help with the education system where the schools are overcrowded and students don't even have beds to sleep in that are in universities and they're paying for it. It could help with, low income housing where, people just don't have the money to pay for apartments, especially in areas like DC, like Washington, DC. There is no, there is no underserved real communities, right? It doesn't matter what ward you live in. The rent is $2,000 for a one bedroom apartment. So our goal in building this initially was just we just focused in healthcare for the moment because we saw the need for isolation. We saw the need for people to still be comfortable and isolated. We saw the need for people to be able to see their families. We saw the need for pop-up pharmacies. We saw the need for areas for doctors to rest. Doctors were working 24/7. They didn't even have a
Oh,
bed to
yes.
sleep in.
No.
So we saw a lot of needs, and now as we've grown it, we also have looked at the needs of the communities around us and what they don't have. Every ghetto, as they call it, has a liquor store
Mhm.
and a pawn shop, but no
Mm.
pharmacy. So how do you get your pharmaceuticals? If you don't have money to get on a bus to go get it, if you don't have a car to go and get it, then there is a huge amount of pharmaceuticals that go uncollected every year,
Absolutely.
millions and millions of dollars. But the pharmacies, they still get their money because the insurance company filled the prescription. But the people are not able to get to the medications. So looking to put pop-up pharmacies in different areas and collaborate with
Wow.
organizations, looking to give senior citizens housing. I have
Hmm.
my father, 76 years old, they can't live off of Social Security or whatever monies that they get from, retirement. It's very difficult to live in this area for that.
Mm.
So these are the type of communities that we want to build that, has smart city initiatives built into it, has beds
Mhm.
built into it, has TVs built into it for pennies. you can
Hmm.
really put up communities and allow people to have healthy living where their healthcare is also built into the space. So we also have a back end that healthcare is built into every space. If you want to option it, you option it. If you don't, you don't. But in an emergency, wouldn't you like to have seen that your doctors can come into your home? But if you are in a underserved community, you may not have a device that a doctor could telehealth
True.
into and
That's a
meet with
great
you.
point.
So we want to break those barriers and build it into the homes. Build it into the facilities that we um, push out across the country, and allow people to have health equity in their living situations, and not just health equity in terms of healthcare, but equity in terms of what's available to them to be healthy, right?
Right.
And that's what 360 Spaces is.
What an incredible and innovative idea. And so I want to give you an opportunity to give some final thoughts as we begin to wrap up. And so as quickly as you can, what needs to happen? We've really painted the picture. We know what's happening out there, and man, there is just a lot of disparity going on. So what needs to happen to adopt these technologies and really make a difference in this industry?
Organizations have to want to do it.
Mm,
It starts at the top. We're a very small firm with a big impact, and unless you can get to organizational leaders and give them ideas and or the tools, and they accept them, there's a lot of pushback. There's a lot of politics around healthcare. There's a lot of politics around equity. It's like this new word, and equity has been around for the longest time. It's disproportionately, resources are disproportionately pushed out. That's what equity is. It doesn't matter if it's healthcare, it doesn't matter if it's education. There are tools available to provide interoperable care and services across the United States, and Vets has those tools. We're a small company, but there are a lot of small companies like Vets that offer these tools, and we have to get around all this red tape. So my goal is to push things out that are free to the people. Let the people use it. Why not? But the problem is that you have to get the doctors and you have to get the healthcare organizations to buy in and say, hey, we want to use it as well because it does benefit them. And everything that we've built today
exactly.
benefits the people and advocate for the people, but it takes some of the burden off of the doctors who are also burnt out and
Yeah, it makes it
really,
easier for them too.
yeah. So it's a two-way street. It's not about money for us. It's about taking care of our community, taking care of our people. It doesn't matter your money. This pandemic showed that we are all in trouble.
Mm.
It's after all of us. So why not come together and make sure that we have the tools that we need from the bottom up?
Absolutely. So it's not one of those things that doesn't exist. It's not out there. It's just not being used. And it's not, that decision to say, let's do this for the better of all and not individual organizations. JaLisa, thank you so much for joining us today. I so appreciate your time and your knowledge and for sharing all of that with us today.
I appreciate it. Thank you so much for having me and giving us a platform to share our passions and our dreams and for a better healthcare system, and to leverage, equity across all areas of life, not just healthcare.
Absolutely. Absolutely. You can tell you are so passionate about it. And I love that. So thank you again for joining us. And thank you for joining us today for Connecting Business. This series is brought to you by Kinetic Business. Be sure to check out all the episodes at kineticbusiness.com/connecting business. Did you love the episode? Have a topic or guest idea? Email us at connectingbusiness@windstream.com. We look forward to sharing more stories with you. Until next time, stay connected.